group meeting, to the social determinants work group meeting for March. Haley will keep us posted on the quorum status as we definitely have minutes to approve. There's no, as far as I can recall, there's no action items that were posted on the agenda, so I don't necessarily think that precludes us from continuing the presentation tonight. It's informational and conversation and discussions. We would ask if you are a member of the work group to please drop your name in the chat so that we can have the roll call vote. And if you're joining us from the public, please be mindful the meeting is recorded, and if you have the desire to speak for public comment, please chat Haley in the using the chat feature, and she'll be sure to call you in accordingly. We have public comment allotted for the towards the end of the meeting. So here's a quick overview of what we're going to touch on today. Definitely a lot of information going to be shared. We're going to provide a higher overview of the feedback regarding wraparound services and the RFP that went out last year and that's hopefully going out for this next coming year. Kind of float and discuss an idea of middle school and high school wraparound services. And then Dawn's going to give us a early childhood education update, some of the work that was recommended and some of the things related to that space. And then I've already shared the Boost one pager. I guess that's going to be more of a like kind of people who want to ask questions. I can kind of share where that came from. And then we have an update regarding the data dashboard that we've been working on. And then we'll have public comment. We do not, I believe, have a quorum. I'm not seeing a quorum present. Okay.
No, we'll monitor and let you know if we need to go back if we have a quorum to approve them, but if not, we can do it at the next meeting.
Okay.
Excuse me, can we just review them so that it refreshes people's memory, and then we can take a formal vote if and when we have the numbers?
By
Sure.
reviewing them, do you want me to pull them up?
Well, okay, if they're not right back there, well, let's just keep going then. For some reason, I thought that they were right there, but they're not.
Oh, sorry about that. No, they're not.
That's okay.
Slides.
That's okay.
They were just emailed out.
Let's just keep going.
Okay.
Okay. So this was a topic that came up at I want to say it was either November or December full body consortium meeting, a discussion around the wraparound services RFP that was out last year and some of the struggles that were being had to access and utilize those funds. And then the consortium sent out a questionnaire to the districts who did not apply for and to seek their feedback as to what happened there. Matt, did you want to kind of talk a little bit through like where we were with that and how we got to this place?
Yeah, the summary is there, and Matt's going to lead us through this discussion.
Oh, okay. Yeah, I think the slide captured the feedback pretty well, and I don't know if you want me to go through point by point. I think that with respect to some of the feedback that was received, the issue may have been that some of the potential applicants thought that the RFP was more restrictive than it was. In other words, that that there were requirements with respect to the application that in fact weren't there. There were a couple of items in the RFP that were identified that had not been part of the epilogue language, and that I believe when the new legislation is put in, that there's going to be some clarification, was purposefully not part of the epilogue language and should not appear in the new version of the RFP, and that has to do with some performance requirements that would have made it more difficult for schools that already had after-school programs, summer programs, or student health centers, would have made it more difficult for them to apply than schools that did not. But it was a good exercise to go through, both for purposes of being able to be more clear, for DOE to be able to be more clear when the next RFP is put out in some areas where the RFP potentially wasn't the first time around. And then again, for the General Assembly to be able to provide some more precise guidance to DOE. The challenge here is that that the consortium makes recommendations to the General Assembly, and then the General Assembly then tries to translate those recommendations into budget epilogue language, and then the Department of Education tries to translate that budget epilogue language into an RFP, and the consortium is not necessarily directly involved in steps 2 and 3. So this has been a good opportunity to circle back around so that when the next RFP goes out, that it is more closely tied to what the intent of the original recommendations had been. But the good news, which Jeff mentioned at the outset, is that we do have 3 schools that did receive grants and that have programs up and running right now.
So Matt, just to underscore the high notes, based on the eligibility criteria, there are 13 eligible schools that could have applied. 3 did apply, and all 3 were awarded. And the solicited feedback came from eligible schools that did not apply.
Correct.
And so 5 of those schools that were eligible that elected not to apply provided the feedback on slide 7.
Yeah, and that actually, I think that may even understate the how large the group that we got feedback from was, because I think that the feedback was in a couple of cases from school districts on behalf of more than one school. So we got a pretty good response, and it was important to us to ask the question of everyone. And thank you, by the way, to the Reading staff for, when I say we, I had, there was no work on my part. So thank you to the Reading staff for actually doing the work.
Great.
So Matt, will this next RFP be for 3 years or for 1 year?
It's going to be, I believe, for 3 years. Everything is contingent on, Senator Lockman's going to put in, new budget language. So everything's contingent on that being approved and what it says. But the intention is for it to be 3 years. And again, to reflect, some of the areas of concern that were raised.
Okay.
And then that 3-year provision is based on the feedback that we got from schools and districts the first time around, which was that, it made it much easier for them to apply for the money if it was for a 3-year period of time, just so that they could make plans and commit funds with some level of assurance that it wasn't going to be a 1 year and done deal.
Are there questions of Matt from social determinant work group members?
I see Tika's comment, and I think what we also are going to try to do, this isn't as much to do with the RFP itself, but the process afterwards. We're going to try to publicize as much as possible the question and answer opportunities that DOE provides to potential applicants. We don't have anything to do with the actual award process, nor do we want to. So we try very hard to make a clear distinction, but we at least want to make people aware of the fact that that DOE is available and when those availabilities are. So if there are any questions the next time around, that people will know where where they can go to get answers. And we are talking about a pretty discrete group of eligible schools. So it should, should be pretty feasible to let everyone know when there's an opportunity to ask questions.
Okay. Thank you, Matt. Are there any questions on the next steps? Any additional questions? All right. I don't see.
So let's go to the next slide, Haley. I think it's going to be questions, and then this will lead into the next topic.
Okay. So moving on to wraparound services for middle and high school. Our charge as a social determinant work group was to look at the needs for services that support students during and after school, a range of services from early learning through high school, through secondary education. And we spent several years focusing on early learning, and rightfully so, where it all begins, from both a funding as well as a policy perspective. And now we really want to start to dig into an exploration and an assessment of what are the needs of middle and high schools around wraparound services and support services. And wraparound services is very broad. So we'd like to have an open discussion for those members that would like to share your perspective and your experience as practitioners. What are the needs for wraparound services for middle and high school students? What are the needs? What are the gaps? So how do you want to use a raise hand function? If you can't find that little icon, you can just raise your real hand. We'll see it. This is an open discussion for you all.
Ray, this is Terry. I'm sorry, I can't raise my hand. I'm driving.
Okay, keep your hands on the
Okay.
wheel.
Thank you. So I would just say that typically there are programming gaps because the students have aged out of any programs that could be considered prevention or well-being promotion. If I'm thinking about after school types of opportunities, whether it's learning or recreational. And then when it comes to some of the intervention related gaps, I think we struggle because many of them are very traditional mental healthy, and kids aren't always amenable to that. So I wish we had more opportunities that were in the youth development space that had some prevention and well-being components, but we're not necessarily in the prevention and behavioral health realm.
I'm listening. I'm taking notes.
Okay, so I hope that makes sense.
So a question. So the intervention related gaps tend to be related to mental health needs. Is that what I heard you say? But there is there's often a reticence for accessing those kind of services. Is that what I heard you say?
Yeah, and I'll see if I can explain a little better. I think they tend to be more traditional, but what some of the research suggests is that there are a number of creative opportunities for kids to build, skills, social and emotional skills that are not necessarily the traditional one-to-one talk therapies.
Gotcha.
So maybe if we had more of a range, yes, that we might find a mechanism to engage some of our less engaged students.
Gotcha. That's helpful.
I saw
Okay.
Tika put something in the chat. I don't
Yeah, I
know.
was just gonna say, Tika made a comment in the chat related to the lack of opportunities for children with disabilities.
Okay.
Do you want to speak on that at all, Tika, about at the middle and high school level specifically, or put in the chat?
Sure, Haley. To be honest, sometimes there's limited opportunities for children with disabilities, even at the elementary level, but especially in middle and high school. And when we talk about people with disabilities, sometimes or oftentimes what people are speaking about now in terms of behaviors and some things that they're seeing are students that may not be students with IEPs, but also students that would qualify. So then they do get those same protections and opportunities. But oftentimes in after school programs, if a child has maybe trouble focusing, or maybe they can become dysregulated or things like that, then the after school programs will call the parent to pick them up, or sometimes not even accept them, similar to what sometimes parents with children with disabilities experience in the early years with childcare.
Thank you. That's important to know. Does anyone else want to weigh in? I don't want to start calling your names because,
And good afternoon, Ray. While I'm not a official member of the work group per se, I think I second what Dr. Lawler was indicating just around the disconnect around services for middle and high school as it relates to wraparound. Again, when we talk about one, I think we have to clearly define what we mean by around wraparound services for middle and high school students. What's school-based wraparound, and then what's community-based wraparound, to be able to almost do an asset mapping around where those gaps particularly are. I know the study was done by and Haley, forgive me, I don't know if it was under WEIC or if it was under Reading, just with regards to community-based, the landscape analysis around the number of nonprofits that offer services, and really looking at that disconnect, because typically that's at the age where purchase of care also drops off. So we're looking at that 12-year age threshold, where now we're looking at youth serving organizations in terms of funding mechanisms is also, I think, where a gap needs to be identified. I recently met with, staff at the Boys and Girls Club, and, the need for them to actually change their service delivery model for youth serving organizations. Once that purchase of care threshold is off or closed off to families, that becomes the disconnect. And so they don't have a lot of youth from the ages of 13 to 18 per se who are actually accessing their facilities. So they're looking almost like a mobile programming type of opportunity to bring the services or supports to youth. So I think that's an area where there's a gap, and that we got to look at the alignment and where those programs are being offered, and ultimately how we're defining wraparound services relative to what we see in elementary school versus what we see in middle and where we see in high. Because if you generally look at where our middle schools are geographically located, all of ours traditionally are in the suburban areas where we know transportation and other issues can create barriers for say wraparound services.
Thank you.
Dawn?
Thank you, Dr. Mender. And Superintendent Green, you talked about the purchase of care. If children, we need to look at children who have disabilities, because children who have disabilities are eligible to utilize purchase of care, I believe up through age 18, it might even be 21. So it stops at age 12 if the child does not have an IEP, but if the child does have an IEP, they can continue to access purchase of care. And I'm not sure if that's something that I'm not sure. So just because a family can access it, it doesn't mean that there's a service or there's a program available where they can attend. But that is something the regulations do allow for the use of purchase care up through high school. For children with disabilities.
Thank you, Dawn. Any other work group members have anything to add?
Yeah, I think Dawn and Tika have brought up some great points around supports for students with disabilities. But I also think it's unfortunate that you have to be a student with a disability in order to access what is likely a very much needed opportunity for students that we're talking about. And so I wonder if there's any latitude, in our definition of wraparound supports, so that we can think about supports for all, particularly from an equity standpoint, and then even looking at entrepreneurial opportunities and career development.
Thanks, Terry. I think that's a great point. It definitely looks different as you get older because of that. There is definitely the academic stigma of being a high school student, needing to be on grade, being college and career ready, and then that propensity to either, check out and not attend classes, and therefore just exacerbating the problem. And the support for that would look different than possibly in the elementary space, considering the environment that the student is in at a secondary level, and it starts to head that way in the middle school. So I definitely think that's an interesting model, like looking at wraparound differently in that for those age groups.
We have some great ideas to get us started.
Mhm.
And I'd also ask for people to just put top of mind working definition in the chat for wraparound services that are school-based and community-based. Except, make a distinction between the two.
I think, Ray, the fundamental bigger question though I thought you and I spoke about this a while back, and actually you've been talking about this for probably, I want to say, since maybe this time last year. You were even asking this group as we were looking at the coming school year, what are we going to do about high schools? I feel like you asked that question many meetings ago. Are we still grappling whether or not that's our space as this work group, or are we?
No, I don't understand the question. I mean, our space is early learning through secondary education, unless somebody tells us differently.
I guess that's what I mean, because we were so heavily focused on the early learning in the early grades. That's why in many of our recommendations previously, I think that might be, is that something that, because we didn't really talk about this kind of we didn't have these kinds of conversations up until, middle of the fall, I feel like. So I think, moving the conversation towards the middle and high school is something I think is well worth, based on the conversation we're here, is worth continuing to explore, I think, more seriously.
Yes. Absolutely. So the purpose of asking, that was one of the action steps that was suggested by our Reading Consortium member, Superintendent Green, was, I think it's helpful to have a working definition. I think it helps people to stimulate their ideas.
Yeah.
So I was just summarizing what we heard. So if anyone wants to add anything else, and then we can move on to the next agenda item. So the intervention related gaps, the challenge from Dr. Lawler was to be more creative in ways to develop youth from a preventive and a well-being focus, and to understand that building protective factors that lead to improved emotional wellness doesn't always have to be traditional counseling. I added some other stuff in there. That's just my summary of what I heard Dr. Lawler say. Chica's points there's a lack of opportunities for children with disabilities at all levels, especially in middle and high school. That includes students with IEPs as well as those that may qualify that don't have IEPs. And then she pointed out that there tend to be children that really need support that are in aftercare programs that the programs are not necessarily designed to meet their needs, and their parents will often call for early pickup. And just because there is a program doesn't mean that that program is prepared, or that even if the programs exist the way that they need to. We talked about Superintendent Green's suggestion that we define wraparound services. Then he pointed out, and I'm hearing this from table to table, where purchase of care drops off. It creates a gap, and that's a combination of a service and a policy issue. And Haley put in the chat that we can go back to the WEIC asset mapping and update it. That's an action step. That the delivery model needs to change. It was clarified that purchase of care can be extended past the age of 12 for children with disabilities. But if we just use 15% of children that actually have, that's generally the percentage that's used in the population that have an identified something that's identified, that means the preponderance of children that are over 12 are locked out unless the programs are designed specifically for teenagers. And then there was another suggestion that we that we look at other kinds of youth development supports, entrepreneurship and career development. We may also, I can't stop. We may also want to consider students that are multi-language learners. Thank you. Okay, so I think that's a good start.
Darrell, did you still have your hand up with a follow-up, Darrell, or was that up from before?
I had another point to make, but I obviously Ray did a good job of capturing everything. I was just going to say from a alignment standpoint of really looking at the work through the lens of the 13 schools that qualified for the RPs, and kind of almost look at where they feed into, just from a system standpoint, to really kind of make sure that, again, almost a gap analysis to look at systems alignment. And I'm only thinking through the lens of Red Clay, for example, right? Where I know, let's just say Warner is one of our schools that qualify. Warner also feeds into 2 of our suburban middle schools, which are Skyline and HB DuPont Middle. So really looking at that middle and what's available, for example, many of our suburban stakeholders obviously access the OCAS and PAL, but then Wilmington students who, attend HB where they come back home, if we looked at community-based wraparound services, where that, again, just to kind of give a full or a complete perspective of the various systems that are in play when we talk about secondary, middle and high school wraparound service.
So thanks, Darrell. Matt, I saw you unmuted yourself. Does that mean you wanted to jump in? You're still working on the tech Zoom hand raising thing there?
I've only been using Zoom since March of 2020, so I haven't quite figured out the hand raising thing yet. I was just going to suggest, just in order to keep things moving forward, I think it would be helpful as people are giving Ray the kind of specific suggestions that she had asked for, if this group also just recommended to the consortium that there be some investment in this area, just so that we could have the consortium itself sign off on that, and then leave it to this group to come up with some of the specifics, which is what we did with the elementary school aged funding. So that way, the formal part of it can be done, and that would also work well in terms of timing. So I don't know that it needs to be more than a one sentence recommendation, but just something for the Reading Consortium to sign off on when it has its meeting next month.
Thanks, Matt. Okay. All right. Thanks for the conversation there and for the chiming in, everyone. Really appreciate it. I think at this point, we're going to turn it over to Dawn, who's got an update for us in the early childhood education space.
Thank you, Dr. Mentor. And I have a Google Slides that I can share. Haley, does that work? Or do you want to share what you have, what I sent to you? It's the same
Nope,
one.
you can go ahead and share. Let me know if you have any trouble sharing it. You should be good.
Great. All right, thank you. So what I'm going to do is I'm not going to put it in slideshow mode because for some reason when I do that, it freezes. Technology, I love it. So, but what I'm grateful that all of you, when our early childhood or when we came to you a couple of years ago and talked about developmental screening and the importance of developmental screening. And the initial ask with the funding was for fiscal year 23 to provide the Department of Education with the funding necessary to be able to prepare to go live with the developmental screening and ensure that all the child cares are able to implement screening yearly. And as most of you may know, I'm not sure if you all know, school districts this is the whole system with developmental screening changed with DOE, and previously each child cares could have their own portal or their own, even if their portal was through DOE, they were still managing all of their own screenings. But now the screenings go through our school districts. And that, of course, it's very exciting to have HB 202 pass. But right now, our districts are only screening about 10% of the children within the child care. So, of course, with this bill going, with implementation happening July 1st, that means a lot more work for the districts to do. So the funding for our first fiscal year helped the district, helped DOE get this off the ground. And then the next ask would be to ensure that districts have the support necessary to be able to implement the screening or to process all the screenings. So what I wanted to share with you is kind of looking at what Child Find is. And Child Find is required through IDEA, and Child Find requires that the LEA or that the lead agency for Part B and Part C. Right now, IDEA Part B for children ages 3 to 21 is within our LEAs, and then birth to 3, Part C is under DHSS and will be moving to DOE in about 2 years. So we are doing all of the Child Find work, and what an IDEA requires that the LEA seek every single child who may be eligible for services. And so utilizing the ASQ really helps all the LEAs to be able to meet that requirement. And so what we try to do is I had the opportunity to work with some colleagues from Red Clay, some colleagues in Colonial with whom I work, and then colleagues throughout Delaware to look at what Child Find looks like. So how long does it take to implement a screening? How long does it take when we looked at referral data, when we looked at the evaluation process from beginning to end? And what I can switch and show you, and hopefully this will work, and I'll send this to all of you, but I wanted to show you the reference for all this information. Let's hope it comes up. So can you all see what it says, Colonial Child Find Staffing? Can you see that? Okay, so this is what we use in Colonial School District, and other districts have similar formulas. I want to give a shout out to our Child Find team in Colonial, and I don't know if any of them were able to join us, but this is the way that our Child Find coordinator, our Child Find teacher, our SEC, our child find coordinator, our OT, PT, speech therapist, how they're documenting all of the work from beginning to end when we look at a child being referred or a family completing the ASQ, then the referral process, and then all the way through the child becoming eligible and registering for preschool. So we look at all of the hours that goes into, from beginning to end, a child becoming eligible for services and receiving those services. So I can send this all out to you, but this is really helpful because it lets us look at when we're recommending FTEs or full-time employees, we need to understand how much work goes into supporting a child before that child ever even registers for preschool, because these are children who are not already in school. So when we look at the child find process, kindergarten and above, these are children who are already in public school, but for our preschoolers, they're not with us. They're not already in school. So I'm not going to go through all this with you, but I just wanted to let you know this is the reference and it's linked to what I'm sending out to you. And it will help you understand why these recommendations are being made. So when we look at the ASQ process from beginning to end, to process each ASQ, it takes approximately 30 minutes. And that is processing it. It is reaching out to the family, reaching out to the child care, doing all the data and documentation. Then there's the referral process. And we look at approximately 60% of our ASQ referrals leading to evaluation. And that's giving the data that districts that are collecting this data, but not all districts are collecting it. So it's something for us to do moving forward. And then when we look at the evaluation process from beginning to end, to evaluate one child who then becomes eligible, it's 32 hours of work. And then if you add in PT and or OT, it's 6 hours for the OT and 6 hours for the PT. So what do we need to do? And I can make this larger. I'm going to go to slideshow and let's cross our fingers and hope it doesn't freeze. Can you see that? Yay. Okay. So this is the ASQ data from all of our districts that are implementing developmental screening at this time. And again, I reached out to our districts. I attend meetings with all of them monthly. And also DOE confirmed a lot of this data. So we have the number of screenings for a year. So from January 1st, 2022 to December 21st, so that should say 31st, pardon me, 22. So 12 months of screening. And we can look at the number of screenings, and there are typically 2 screenings per child. So there's an ASQ and ASQ SC. And then we look at capacity for each district. And looking at this percentage, this is how many children we're actually screening right now within the district, the number of additional screenings, the hours to process, and then what that looks like when it comes to FTEs. So this is the work of just the screening. Then the next slide is putting in, there's a lot of data here, but this next slide is looking at the FTEs for all of the work. So the evaluation process, or the ASQ to referral to evaluation to eligibility. And these are projected numbers. Again, we keep this data, Colonial keeps this data. I had the opportunity to work with several people in Red Clay who keep this data. Their colleagues in Smyrna and Woodbridge. So several districts are keeping this data and keeping really clean data. And then other districts are not. And this is because, and part of it is because they're not required to keep this data. So I tried to take what everyone put together and shared to say, if this data were clean, what it would look like with FTEs for all of the work to go through beginning to end for evaluation process. And then so that you can see for each district, and obviously our small districts, what would be needed is we're asking for much less. And then our districts that are much larger, like Christina, Red Clay, Colonial, Indian River, we have districts that are larger, or Cesar Rodney, that need more support. And then some feedback I wanted to share with you from the districts, because they're anticipating how their work is going to increase exponentially, because they are only screening about 10% of the children in child cares. As of July 1st, they will be screening all of the children in child cares, because that is the new law. So there are concerns from our our districts, our Child Find teams statewide, because they want to make sure that they're able to do this work and do it well, and have the support to do it. And the turnaround time is about 2 weeks. That's the expectation for the screening. So the screenings come in, there's a 2-week turnaround. The screeners in each district, they're reaching out to child cares, they're reaching out to families, they're making referrals, they're collecting all that data and putting it into their data portals. So I wanted to share this with you so you can see that people are anticipating a lot more work, and they want to be able to stay on top of this work and to do it well. And I'm going to put this link in the chat when we're done. So we know that the research demonstrates that early intervention works, and the earlier children receive early intervention, the greater the outcomes for children and their families, and also for our system. So this looks like a big ask because we haven't been doing this before, but we know that when we spend $1 early, we can save up to $13 later. And this is also the national data that's supported through IDEA. So when we look at our national data for states that are doing this and doing this well with fidelity, that you spend the $1 now, you save the money for in the K-12 system later. So the asks for us to consider would be looking at fiscal year 24. So in epilogue, looking at that funding, the recommendation to ensure that at the very least, we are providing our districts with the FTEs to implement the developmental screening. And then I've worked on epilogue language previously. It's something I've done before, so I could put something together to share with our team that where we're saying we have to fund the screening now at the very least. And then we ask our districts to keep the clean data. So even though they're not required to submit this to DOE right now, the best way that we can recommend funding for psychologists, OTs, PT, speech therapists is to have the clean data for every district. And we don't have that right now. So for fiscal year 24, at the very least, using this data to ensure that we have the staff to do the screenings. And then for fiscal year 25, having the clean data and making the recommendations for all the staff to be able to do this work for our Child Find teams. So I'm happy to answer any questions to the best of my ability. And I'm grateful for everyone's support for developmental screening to make sure that we are able to identify children who may be eligible for special education services as early in life as possible.
Thank you, Dawn.
You bet. Thank you, Dr. Menzer. So I can stop sharing and answer questions.
Dawn, are you going to share that PowerPoint with Haley so she
Yeah,
can?
so I did share it with her, but I'll share it again. And there are links in there.
Okay,
So
then we'll make sure that it gets out to the work group members.
Yes, and so the ask would be that we bring this up to the larger group, because an unfunded mandate doesn't work. So we knew that the funding for the first year would be to support DOE. Now we need the funding to support our districts to ensure that the districts have the support they need to do it.
Okay. Thanks, Dawn.
Thank you, Dr. Menzer.
All right, Haley, you want to bring up the agenda again? So I'm gonna cede this time to if you can go to the last one, Haley, you're gonna let because we do have Katie Samuel from DSC and joining us here, and I wanted to let her use some time to talk about the equity dashboard and share on the update. I know, Katie, are you still with us? I know I didn't have her on I didn't know she was going to be joining us. So if she's here, we did definitely want to let her get in because I know her time, she may have had other commitments.
I'm here.
Great.
Hi, everybody.
Hey, Katie. You want to provide an update for us on the equity dashboard?
Sure. So we delivered two items to DOE. One was a comprehensive design document that basically took every screen of the prototype and very specifically defined out what should be on that screen. And then the other piece of that is we use an application called Adobe XD to create the designs, and that product has a developer view of the design. And so we provided that as well. So there's discussion about whether or not DSC is going to do the development or if it needs to go out for RFP. But the purpose of those two documents is that whoever does the development of the equity dashboard has all the things that they need to get that done. So the next big step in kind of getting, moving towards creating the dashboard is getting the City of Wilmington addresses tagged in geocode in eSchool. So I got an email today that contract with the University of Delaware is being circulated for signatures. So so that is moving forward. Once that happens, for the LEAs who are using our iTracker Pro application, we can bring that data into iTracker Pro and start looking at the data. Because right now, like, we haven't actually looked at real data yet, based off of the addresses being correctly identified in geocode. So we'll do that work once we know who the City of Wilmington kids are on a regular, reliable basis, and get that in iTracker so schools can start to look at some of the reports in there based off of City of Wilmington students. So that's kind of where we are. Is that?
Yeah, Katie, can you give a refresher to the group, like why that geocoding was so important, how that's different than maybe in the
Yes.
past, and why that was actually quietly a big step here, I think, in the process.
Sure. So I think a lot of the City of Wilmington reporting has been around zip codes. And as many of you may know, the zip codes can go outside of the City of Wilmington boundaries. And it was important to this group, and I think Reading Consortium as a whole, to make sure that we know who those kids are. So there's nothing in the student information system that says this specific address is the City of Wilmington address. That requires additional coding in the system that identifies Delaware addresses and feeder schools for kids and things like that. So a gentleman by the name of John Lasnik at the University of Delaware does all the geocoding work for the state of Delaware. Like, he knows every street, what district that street is in, what house that's, every house. He's amazing. He's a savant with the streets in Delaware. So he will do that work. And it's only a 3-week project. So I don't know, Jeff, does that answer your question?
No, I think it does, because I know that
Okay.
that it kind of like poked its head out a little bit when we were talking at the full body meeting. Just so people were wondering, well, we know who lives in the City of Wilmington. Well, we do, but we don't have a way to tag them. And I think this geocoding was a critical piece that we were waiting to get the final move forward on. So
Exactly.
good to hear that today that's making its rounds. That's exciting.
Yeah. It seems like a small step, but it's actually a big step.
Yes.
So.
If that didn't happen, this dashboard wouldn't have worked.
Exactly.
It wouldn't work. So that's why this is a seemingly small step, but pretty huge.
Mm-hmm.
Yeah, great. Any questions from work group members for Katie around the dashboard? I will add, Katie, that following the full body consortium meeting, you did share the prototype for feedback with the full body Reading, if I'm not mistaken, just like.
Yeah, Haley did. Yeah, she
Haley
did.
did. So
Yep.
everyone was able to kind of manipulate a little bit more than was afforded during the meeting at DSU. So I do think that that's important to note your ability to share that with them. And while there was little impact that would have on what you submitted, what you gathered is going to be helpful for the next phase, next process, or the next group, whoever takes it over, if it is not DSC or if it is DSC,
Yep.
in terms of the implementation phase.
Hey, Katie, this is Roger.
Hi, Roger.
The small group, are we still convening, or are we done meeting for now?
We're done meeting for now until we kind of know what the next path forward is in terms of defining future iterations and development for it. So there's big decisions in the state that are happening hopefully in the next few weeks, and that will help let us know kind of what path we're on. So
Okay, thank you.
So, thank you, Katie.
Mhm.
So, Jeff,
Yes.
I just want to do an extra push for those members of the Social Determinants Work Group and the Reading Consortium that have not had an opportunity to take a look at the prototype that was sent to you, so that you could see it more clearly than on the screen at our last Reading Consortium meeting. Would you please take a few moments to look at that prototype? And it has a section for comments. That's really is going to be very helpful to fine tune the design of it.
Yeah, and to Ray's point, this is an early on iteration of this project. Katie, as she clarified for the Reading Consortium and for this group before, this is data that's readily accessible. We didn't have to do anything to get access to it. There was no change for anybody to have to add a field to submit something. This is just living, breathing data that teachers and staff use on a regular basis that we were attempting to capture and look at through this lens of the city of Wilmington in order to help inform families and educators and policymakers around, achievement, school-related data and social determinant-related data that's in the database that can help drive programming decision as well as make family decisions. It's a wide open lens. So definitely early on, feedback is of the utmost. When you get a chance to, Haley will share that. I just saw her put in the chat the link to that version, so everyone can kind of see and get an idea of what it looks like. Thanks, Katie.
no problem. Thank you.
Jeff, I
Yep.
think the last agenda item is Boost.
Yep. So a quick recap for those who are relatively new to the room. Boost was an effort that the chiefs who serve the city of Wilmington, the superintendents who serve the city of Wilmington, made a commitment back in, actually started talking about it pre-COVID, and then, COVID hit and we continued to talk through, like, what does it look like? And we had made a commitment that we were going to collaboratively, we were going to work across district lines and look at students from the city of Wilmington through a different lens, primarily from a community support approach, as opposed to 5 different silos: Brandywine, Red Clay, Colonial, Christina, and Newcastle County Votech, just working with our students and just saying, oh, we got ours, you get yours. We were looking at it from more of a community collective approach. We made some commitments to work across district lines, to work with families, regardless of where they went to school. We were able to utilize the geocoding on a small scale with John Lasnik for the seniors in the class of 2022. And we are currently using that same feature this summer we flipped to now focus on 9th graders, first-time 9th graders, which is the Boost 26 effort, where we recognize that if we can get our first-time 9th graders to their 10th grade year, they are more likely to graduate than not. That's a huge transition year. And so what we also did with that data set of seniors who graduated in 2022 that lived in the city of Wilmington, we asked the University of Delaware to tell us, what do they look like? What was their story? What can we learn from them as we now turn our sights to the 9th graders? And they conducted this past summer and into the fall an analysis of the 2022 grad. And they kind of shared with us, they gave us a pretty interesting report that we needed to be distilled down to a 1-pager so we could explain it, because it was a little bit, it can be a little bit confusing, and I'll show you why in a second. Haley, do you have the 1-pager available, or am I gonna wing that?
No, I can pull it up. Just give me a second. I have to stop sharing this.
All
So,
right.
1 second. It's just buried in like 14 different folders, but here it is.
So this was shared with all the work group members when we sent out the meeting, the notice for the meeting today. And you can see here, it's just they give a very high level overview of the Boost 22 group. The exciting piece of data here, 75% of the students in the cohort graduated, and that's actually higher because UD pulled their data in June. We had, I believe, many more students graduate through the course of the summer and into the beginning of September. I believe the actual number ended up being closer to, I want to say 86 or 87%. I can't recall when Data Service Center pulled the number for us in September, but it was too late to get that number out there to Delaware. They needed the data early in June to begin. But you can see the demographics, the racial breakdown of the students in that cohort. And then you can see down below the next column, the residential profile. This is where it feels like we went backwards because we were saying don't use zip codes. And this is why it's, the reports can get a little bit confusing, is the zip codes do still have merit, because if you look for those students who live in the city of Wilmington, you can see based on the 3 main zip codes, their graduation status from this cohort, their median household income using census tract data, and then also their average rate of attendance. What we found astounding was this group of students, these seniors, went to school. I mean, their average attendance rate was somewhere around 93%, which is, in the world of school, that's pretty darn impressive. And so looking at this data here tells us where we would zero in and focus our energies and our resources as well, in terms of like the residential area, like where do students live? Where do we got to provide those community supports? And when we looked at this data first thing in January, Darrell's first words out of Darrell's mouth were what he just said here. There's an asset map somewhere that's going to tell us how we can help, how we can leverage community resources to work with these, what were now our first time 9th graders, who are now our Boost 26. There are 26 grads. So we're beginning to like put that, we're starting to have those conversations across districts in a way that's not been done before, where we're not just looking at it at Dickinson and William Penn. It's more who's in that community and how can we support them. It's not easy work because it's hard. It's because it's not naturally set up that way. The systems don't cross over. And so then there's some other academic achievement data that they shared. They looked at math completion as well as enrollment in CTE courses and dual enrollment courses. It was an eye opener for us, and it's afforded us the ability to share that data with some of our folks who are working on the ground floor to get an understanding of who these students are and where they go to, what classes they take, and how they attend school. So I share that. I mean, it's been out there for, I think we started talking around this 1-pager maybe 2 months ago, beginning of February. So that was it. Just wanted to provide that update because I know I've been talking about Boost, seems like forever and a day in this group. That's it for me. Darrell, I don't want to call you out or but call you in. Did you have anything further to add about where we've been, where we are with Boost and what we're looking like towards the future?
No, I think you hit all the highlights, Jeff. I just think the importance of on track to graduate with the cohort. So when we talk about our ninth graders and really looking at Boost 26 is that idea of being on track to graduate with your ninth grade cohort is critical. I think although our accountability model allows us in the state to, use 5th and 6th year. So, extending that period of time by which students can graduate, but we know that the longer we prolong that graduation, the more difficult it is for students to complete. And then the only other thing is the ability to look at social drivers of health, social determinants of health, but really looking at that data overlay. So based on that one pager, if you looked at 19801,
right. What's happening there?
but I think that's the important thing, Ray, where we can actually get to that point now to start looking at other data sets, whether that's community related data, other aspects to look at data overlays, to look at trend data within the community. Is that a hot spot for, social drivers or social determinants of health, where there might be other aspects that are going on in the community that we don't traditionally look at through the school lens. So I think really using school level data to start highlighting some of these other social determinants of health, the social drivers of health, going back to our earlier conversation around wraparound services. Is there a deficit of services within 19801 that we're not really paying keen attention to? Are there other health outcomes or factors that are not necessarily being closely looked at or aligned? And I know when we talked about at the last full committee meeting around the data dashboard, because that will help, I think, allow us to pull in some of that other community related data to look at a data overlay to see, what are some of those social drivers or social determinants of health issues that our students, families, and community might be impacted by. And I think then us as districts, who albeit we have our kind of feeder pattern lines, we're still serving 19801 collectively. And how are we aligning our resources to be able to create unique or universal programming across districts, regardless of where students are going from. And I think that's one of the lessons that we learned through COVID as an outcome of that data.
Roger put a question in the chat. I know that I believe Colonial has a piece of 19801. I think Christina and Darrell, do you have any part of 19801 because it's the center, it's the heart of the city, I believe.
It's East Wilmington.
Yeah.
I live in 19801 and I live on Washington Street, which is not east, is going west.
Right. Yeah. So I think we all do. And again, once you look at choice, when you look at charter, when you look at mobility, again, I think the beauty of this is not looking at it through feeder pattern or traditional lens, because that's why we looked at it based on address, because of where boundaries are drawn, where feeder pattern lines are drawn, and even within the district. We have certain sections of our district where it might appear to be an AI feeder, but we've carved out a little niche of that feeder pattern that goes to McCain, for example. So I think solely basing it off of off of zip code again, and really looking at it through the geo mapping data really gives us a deeper look within the community or communities within zip codes, because there are various communities within the zip codes that operate completely different within the city of Wilmington.
Yep. Thanks, Terrell. Good question, Roger. Thanks for kind of assume sometimes that, maybe there's one, but it runs across districts. And I think to Darrell's point, looking at it as a community and how we can support the community through a different lens is what we're really driving at by having these conversations now with our own staff and the agencies and the support groups who we work with at the secondary level specifically, because Boost is completely focused on high school age students thus far. That's it for me, Ray.
Oh, thank you. Can you just quickly repeat the kinds of supports that are given to students?
So each district, when we started this, identified resources that they use to what we keep students on track to graduate. So whether it's actually counselors, therapists. We use outside groups such as communities and schools who provide from mentoring, tutoring to basic family life skills, support with social agencies. Tutoring for students is a big one. That's the support that's identified because it's academically based, because you have to earn your credit to go to the next grade level. So this year we've been focused heavily on tutoring resources that are within the schools. And I know the visiting teachers are also in the districts have played a huge part in this because of the attendance. So those are just some of the resources that I can speak to, off the top of my head.
Is it pretty much the same for Red Clay?
Yes, we coordinated the efforts. Again, I think it was aligned. It was also school dependent. So as the graduation coordinators work with school counselors, building level support teams, again, to Jeff's point, whether a student was deemed homeless, right, or was there an issue, because again, we were talking not even post-pandemic, but going back in for the class of 2022 after what we experienced, but just realizing how many of them actually were potentially unaccompanied youth because they were working. So what were those care coordinated supports and services that they needed as individuals? And then looked at trends across schools and across districts to see how we could prop up and align services without it being a Red Clay specific or a Brandywine. So communities and schools and graduation coordinators work closely together to align those supports and services and identify trends across districts.
Thank you. Thank you both. I'm really excited about Boost. I think it's a great pilot and a great example of cross-district collaboration in support of students in the city of Wilmington. So I'm a big advocate for what you're doing. So thank you.
Thanks, Ray. Appreciate it. I mean, we are excited. I mean, it's as it's noted in the chat, when you're working across different agencies and different groups, it is not easy, even though we all have the same general charge. We have different operating systems, different structures, but we're kind of, we haven't let go. We haven't given up yet. Like we keep going. We just keep going and going until we, I think that's the best I can say about the relationship we have at the senior level in the districts between Dan, Link, Darrell, and Joe and myself. When we meet monthly, we just touch base and see where are we, what's going on. We have the data dashboard, like we get the marking period reports for the students, and it compares last year's ninth graders this time to this year's this time. So we can kind of see, like, what are we doing? Are we making a difference? Like, what's going on here? Where are we struggling? And so having access to that data quicker than later is definitely helps us kind of push a little bit on it. So we're excited. I mean, I think it has definite potential.
Absolutely. Great. So we are at our public comment period. If there's anyone that would like to make public comment, it's 2 minutes per speaker.
Do have in the chat that Amy would like to make a comment. She's still on. Yep. Amy, go ahead if you're available to make the comment.
Okay, can you hear me?
Yep.
Hey guys, my name is Amy Gallagher, and I just wanted to make a comment. You're talking a lot about data, and the one pager, I guess, was analyzed or researched by UD researchers. And I recently went and read Clay. They have all these kind of subcommittees that the school board is involved in, and I went to the achievement one. And I missed part of the data presentation. So I followed up with that team, and I had a nice hour and a half with them, and I asked them a lot of questions. And one of the things that just came into my attention, like in the course of asking questions and learning about they're, sorry, I have to decline a phone call. Sorry about that. So sorry, they lost my train of thought here. So they've been doing these pilots for, let's say, K-5 or no, K to second grade, 95% and you fly, and they've shown remarkable improvements, let's say at Shortledge between the beginning of the year, like at 64%, and they went up to 39% proficiency, you know, now, and the last marking period. So these, it's nice to track the data and to know that, you know, the 12 hours of professional development, science of reading is really perhaps working, and you can see this data. And it just came to my attention that eSchool is up for RFP, and I guess we'll get to know what that new system's going to be. But these RFPs, you know, I guess the data management system these days, you can get live analytics, but that might be pricier. And what I don't understand is in the RFP process, who in the DOE or at the superintendent level is flagging these RFPs that might have a real impact on how we can use data. And if we have a choice with live analytics, if that's outside of the budget, can we move the budget around to get what we need so that we can, instead of having researchers have to do this data, we just have access to a system that can locate, you know, kids with an F, 10 absences and 3 referrals, and then, you know, locate those kids very easily and get out to the right people, you know, what wraparound services or, you know, whatever you need to do to combine the data that you might have, you know, with these boost programs or what else, or even at the lower levels with these new pilots that you're doing. I mean, there's just so many opportunities with this data. And someone like me, just like Joe Schmo off the street, I can't follow the RFPs or know about them, but I guess eSchool you've had for 13 or 14 years, and it's an outdated system. And to me, it's a real equity opportunity to get a kind of top of the line system in there. And I just don't know if it's in the budget or what's going to happen, but I just wanted to bring that up, and I'm interested to know the outcome. So thank you.
Thanks, Amy.
Unmute.
Haley, did we have any other hands up for public comment?
Not that I'm seeing.
Great. Do we have a quorum?
I think we
don't-
got close, but I don't think so.
I was
No.
gonna say, I thought Roger might put us over the top, but he didn't tonight. All right. So
You know, what number are we using? We have myself, you, Dawn, Roger, Tika, Terry.
Well, I think the thing is we kind of have to revisit our membership as we.
yeah, we got to get our numbers
that are
back to a
because of-
number that.
No, but you use the number that you have
Officially,
that
it's
of
10.
active people, huh?
Oh, you use active. I was just using the total. I didn't want to, I was going very safe. So I was
Yeah.
using the total number of members,
Plus
basing
one.
it off that number. So it'd be 10 people. But I think we can revisit for the next meeting if we want to shift
Yeah,
that.
because we have
quorum.
people that are definitely
Not
Yeah.
participating.
so you
Mhm.
don't we can't use the same number as we did 2 years ago.
Yeah, I think we should get
Mhm.
that number cleaned up before we go into the next meeting.
Sounds good.
So
All right.
Dawn has her hand raised. 1, 2. Dawn.
Thank you. And that's what I was going to ask. If someone was a member and representing a certain organization, if we're asking someone else from that organization to replace that person,
Yep.
or I know, for example, Representative Williams had said, I think that Haley, you had said that Representative Williams was asking to step down. So is another legislator being asked to take her place? But
Yeah.
in the meantime, there are things like what I shared tonight. I would love for us to vote to be able to elevate that and do things will things just be kind of hanging out until we can decide what we're doing with our membership?
No, things will not just be hanging out. I can assure you of that.
No.
We're having those replacement conversations with the leadership of Matt and Senator Lockman.
Yes,
And
yep.
next month we'll have it sorted out.
Yep. Yeah, we are on track to get us to that space, Dawn. Thank
Great.
you.
Thank you so much.
Yep.
Thank you.
Okay. I think that's it.
You can also ask for an electronic vote. So those of us that are for future reference,
Okay.
for minutes. Mhm.
Per
Okay.
minute. All right.
Co-chair, are you ready to close us out?
I was waiting for you, Ray. You always close us out so eloquently.
Yeah, this is the way I close. Bye.
Take care, all. Thank you for coming tonight.
Okay,
Really
thank you. Thank
appreciate
you,
it.
Darrell. We'll follow
Yeah,
up with you.
noted, Darrell. Thank
Okay.
you.
Yeah,
Thank you, everybody.
Yep.
Have a
Take
great
care,
week.
everyone.